Good day, it's Dr. Rapiti. Welcome to another video. It's Friday, the 12th of September 2025, and today I want to talk about a 40-year-old female who I diagnosed with myocarditis. Myocarditis is the inflammation of the heart muscle. This patient presented to me during the Delta strain in 2021 with a COVID pneumonia. She was treated very successfully and she did quite well. But she, like many of her colleagues, were forced by an insurance company where she worked for to take the vaccine. And I must just inform you about the vaccine and the insurance and the employer. They were guided by the labor law, which informed them through the law, incorrectly I must say, that COVID was a very dangerous disease. There was no treatment for it. But however, the labor law did not, or the Labor Department did not compel these companies to force their employees to take the vaccine. All they said, they must do what is best. If you look at the time when the vaccines were given, it was given during the Delta strain. It was at a time when the vaccine that was used was totally resistant to combat the Delta strain. Nevertheless, shortly after that, that was about a year or two later, and this is how long a vaccine injury can take place. She presented to me with extreme shortness of breath, which made me suspicious that she either had a pneumonia or she had a heart failure, because both have similar symptoms, saving that with the pneumonia you have a fever. She was sent for an X-ray, and I did an antibody test. And believe it or not, her X-ray showed that she had a very enlarged or double the size heart, suggesting that she had severe heart failure. And consequent to the heart failure, she had fluid in the lungs, which explained a shortness of breath. And to confirm that it was a vaccine injury, I did what's called a spike antibody test. And that test came out to be about 4,550, and the normal antibody test should be less than 50. And what we do know now, that the spike protein of the vaccine doesn't leave your body. We don't know how long it can last, but studies have shown it can be lying in your body for as long as 2 years. So the problem here now is this young lady who did very well, recovered from COVID, would have had natural immunity, did not need a vaccine, was forced to take a vaccine. She now has severe heart failure. She's short of breath. And to top it all, a medical aid is not interested in giving her much help. They put us through a lot of passages of grief, trying to get all the medications authorized. And what bothers me is that we're not seeing these, we're not correlating these injuries to the body with the vaccine, because the time of the vaccine and the time of the injury is so far apart. I think we need to understand that it can take quite some time before you can pick up the vaccine injuries, because often it's an autoimmune reaction. What that means, in this case, the spike protein landed in the heart muscle, then the body's antibodies attacked the heart muscle and caused inflammation. The prognosis is not very good, and what saddens me is that the insurance company that she's still working for takes no responsibility. Nobody's being held accountable for it, and that is unfair, because the poor lady has now to suffer with a condition in the prime of her life with limited physical effort and tolerability. And it can't be a very pleasant experience for her. And nobody's taking responsibility, or is she being compensated? And I think we shouldn't let it rest at that. I mean, the mere fact that nobody's taking accountability or is compensating her makes it very difficult for us to ever accept or take the advice of our so-called experts and authorities on anything related to the vaccines in the future. I think the story, even if they go about saying that the COVID vaccine saved millions of lives, what they are failing, and deliberately so, not to tell you, is that the COVID vaccines is associated with millions of deaths and millions more of side effects which are not being taken into account seriously. And it's the poor patients who are obliged took the vaccines, suffering and paying the consequences out of their sheer innocence to follow so-called patriotically. Anybody who dared to question the vaccine and its efficacy or side effects was considered conspiracy theorists and unpatriotic. Well, the worms have come out of the wood. We can see the evidence, and I think it's about time somebody takes responsibility for this. So if any of you are suffering from any serious unexplained side effect of the vaccine, I think we should have some form of registration system whereby people can complain or report their side effects so we can get a fair analysis, because I don't believe the true story about the COVID vaccine and its side effects are fully appreciated well enough for us to do something serious to stop the rollout of these vaccines. I hope you have learnt, and I hope we'll be more judicious in the future before we go gung-ho and start recommending vaccines that are not properly tested and tried. Take care. Have a good day. Dr. Rapiti.